Let's head to Sydney. Dominic Perrottet, the New...
Out in Wagga Wagga yesterday, meeting many of the nurses and doctors and thanking them for the work that they do. Over the last 2 years, they have worked tirelessly to keep people safe. They're incredibly proud of the work that they do every single day. And on behalf of the people of New South Wales, can I thank you for the work that you've done over the last 2 years and as we move through the challenges of this next period. I'd also like to speak briefly in relation to the PCR, and Dominic will also provide some further information in relation to the process. We apologise for any inconvenience with those long queues. I know there are substantial efforts that are being made. Rest assured we are doing everything we can to put downward pressure on those queues right across the state. I spoke with the Prime Minister this morning, and obviously we'll be having National Cabinet tomorrow. Looking forward to a discussion in relation to changes to be made in relation to close contact definitions and isolation periods. I certainly believe it would be best if we had a national approach, and I certainly look forward to having those discussions as we move through the meeting tomorrow. I want to thank Annastacia Palaszczuk for the decision that she made today in relation to the removal of the requirement for a PCR test from 1 January. So to say to people, if you are travelling to Queensland from 1 January, there is no reason and no need, and you should not be in any of those queues for PCR testing. There are many people who are lining up in those queues who do not need to be there. And we are doing everything that we can to increase capacity and put downward pressure on those queues. But if you are not sick, if you do not have any symptoms, you are not unwell, or have not been advised by New South Wales Health to receive a PCR test, you should not be lining up for one. We still are hearing that there are many people who are receiving these tests who are lining up, and by doing that, you're taking the place of somebody who needs to receive one of those PCR tests. So, clear message today, the system will improve. Some of the changes that have been made from the Queensland Premier today will really help ease pressure on that system, but still, the number one thing we can do is follow the advice that we've received from health. If you are not unwell, or you have not been advised by New South Wales Health to receive a PCR test, you should not be lining up for one. I'm now going to pass to the Health Minister, who will provide a health update, then Dr. Chant will provide a public health update, and then Dominic will provide some information in relation to some of the challenges in respect of pathology, and then we'll take your questions.
Thanks, Premier. Look, clearly we're moving into another major stage of this pandemic, and we're seeing a lot more Omicron, as is being seen right across the world. We know that Omicron, on all the evidence internationally and now here in New South Wales and Australia, is certainly far more transmissible. So chances are you're going to get it. We'll all get it. And therefore we need to understand at what points we need to rely on our health system. The PCR tests are there for a reason. I'll ask Dr. Chant and Professor Dwyer to actually clarify aspects of that, in addition to what the Premier's already said. But if you really don't need a PCR test, if you just think you're part of the community that can go and get one for free, all you're doing is actually getting in the way of people who are really needing PCR tests.